Yeah, we're live. Oh, we're live. Thank you. Welcome back to Senate Economic Development, Housing and General Affairs. We are now pivoting to cannabis, having just passed out or almost fully passed out the unpaid leave bill. So we are going to begin. We had sent the director of the Cannabis Control Board off with many of the stakeholders to develop a proposal of amendment, and we have several to consider. You want to address them as a group, and then we'll individually look at them?
Sure, that's great. Yes, so for the record, James Pepper, Chair of the Cannabis Control Board. And yeah, I mean, there's been a lot of testimony that you've heard here in the roundtable, the Lieutenant Governor's roundtable and elsewhere that have kind of coalesced around a few issues. And so I have drafted some proposals for this committee to consider. You know, one is around a cannabis showcase event permit. This is, you know, just in the kind of vernacular, kind of a farmer's market for adults only that would allow for off-premises cannabis sales to people over 21. The other is a funding issue that around the Cannabis Control Board about whether the board should be partially funded through cannabis excise tax or general funds. So there's a proposal around that I can share. And then the last is, you know, a re-examining of some fees, which, you know, historically would be in the Finance Committee, but, you know, it's kind of hard to separate market structure and
Right.
fees. You know,
So I think on that, just for those of you who are, I mean, we're trying very hard this year to stay in our jurisdictional lanes. So while I think it will be part of the package and we may incorporate it in, I think that the real work, Thomas, our embedded finance people, Thomas and Randy, we will probably include them in this just because you're right, it's woven into the cannabis work. But I think we will delegate that entire conversation to the Finance Committee.
Okay, so I should have, I think, 3 proposals under my name for today. Is that right, Heidi?
Well, they're not up because I knew you two were discussing.
Oh, okay.
And I didn't have.
Okay, then I can, is the easiest way to join the meeting and share my screen?
Yes.
Okay. Okay, and I'm not positive I have the link.
I just sent it
Oh, perfect.
to you and Kate.
I can begin talking while I connect to the internet and join the meeting.
Yeah. I know you're an accomplished multitasker, but perhaps do one thing at a time.
So
Did you have anything to do with emails I'm getting today on the impact of recreational marijuana laws on workers' compensation benefits?
I don't believe so.
Someone is
but,
wrong.
It's
It's interesting, it's a study. I'll send it to you.
okay. Generally speaking, the framework here is you would allow a retailer who's in good standing with the board and in partnership with a minimum of 3 cultivators or manufacturers to seek a permit first locally from a town, legislative body or designee or Cannabis Control Commission if they have one, and then from the CCB to hold an adults only farmers.
Is this language he can project?
Yes.
That's what he's attempting to do. That is why I would encourage him to do that before he.
Okay.
And if you could, send Pepper's language to the committee.
I'm doing that
That would
right now.
be great, because we don't have paper. I printed it out, but I realized that everybody doesn't have it. Are you able to join?
Yes, of course.
Oh, sorry. Wait, that's not you. Are you? Yeah, that is.
Of course, we're optimized for Teams, not Zoom in the executive branch, so.
And we all hate
asking me-
Teams.
Yeah.
I love Teams. But
You
it's
do?
all- Yeah, it's
Oh my
all yours
God.
at UVM. So.
Can't be. Try and hide. Because we.
Let's talk.
Oh, thank you. Okay, is that? Okay.
If if you could make it a tad bigger for those of us who are blind. Or, oh, well, it's not getting bigger. Let's just go for it, because I know your time is limited. Oh, perfect.
Okay, so just very brief context. New York State, they licensed all of their growers, and then their scheme for issuing retail licenses got held up in court. So you had all these growers growing for 2 years with no legal place to sell their product, which creates other issues. So they, through emergency rule, created a farmers market authorization, and they've been holding farmers markets for about 1.5 years, I believe. And because they were successful and none of the kind of public safety concerns or youth access concerns, inversion, diversion concerns, because those were never realized, they made that authorization permanent. So this is kind of built upon the New York State, paradigm, and it adds in a little bit of kind of the limited event alcohol permitting that we do, some of the kind of concepts from that. So the basic premise is you're a retailer in good standing with the board, you have a clean compliance history, you can apply for a permit for, I'm calling it a cannabis showcase event. In New York, it's called a cannabis grower showcase. And this would allow you to hold in a defined access controlled location, a farmer's market. So you have to, first thing you do is you get kind of local sign off for the concept. So whatever the local select board, or if there's a local cannabis commission, they have to kind of agree to it, and they can condition the permit however they see fit. You need to then go to the cannabis board and kind of demonstrate that you have that local approval, that you've partnered with a minimum of 3 licensed cultivators or product manufacturers that are also in good standing with the board. You have to present us a security plan that essentially mimics a retail shop with the kind of ID checking at the door, making sure there's no intoxicated people or underage people coming in, that the location is secured against diversion, inversion, or kind of public safety risks. You have to kind of give us a product sale plan that describes the exact amounts of products and the amounts that you're going to be selling at the event. That you have the actual intent and capacity to administer the kind of plan as you're presenting it to the board. Proof of commercially reasonable insurance for the proposed event. I was on the phone with an insurance underwriter the other day that kind of had some thoughts about this. That essentially things, if things go poorly, then if there's inversion, diversion, youth sales, whatever else, it's the kind of retailer's license who's on the line for getting penalized. I didn't include a fee.
And you could have a number of retailers joining together, and you could have a number of growers. I mean, this doesn't limit the participation in the market to 3. This would be.
So long as you have a minimum of 3, a retailer could apply for this, and they could be kind of co-located in a single space. The fee, each grower would do direct sales at that market to an individual, or would the sales still have to go through a retailer? The sales, in my vision, would have to go through the retailer's point of sale system. Right. But the cultivators could interact directly with the consumers, and the retailers and the cultivators could work out whatever kind of profit sharing arrangement that they would want. I did a 50-50 split in the fee, whatever it ends up being, between the state and the local municipality, the kind of host municipality. I mean, that's a decision point for either this committee or the finance committee. And then I have a report back. I mean, here's essentially, this can't, just like New York, my feeling is this should be a temporary authorization, just given that our resources, we can accommodate a pilot program with this kind of framework, but we can't all of a sudden just go from having, 111 retailers to having farmers markets with points of sale access every kind of Saturday,
My understanding was this was to be a pilot.
So that's my recommendation. I don't know how you wanted to limit it. I was thinking, the whole kind of purpose of this is just to kind of do a proof of concept that a cannabis sale can happen outside of the explicit kind of brick and mortar retail location. So honestly, just doing one would be fine, but I was thinking just in order to maximize, to give everyone an opportunity in the state, to participate, you might want to do north, south, east, west, and central. So
So up to five,
up to five.
up to 5 events, and then have a report back this December or January?
Yeah, exactly. I mean, I said January 15th, but it could be easily December 31st.
Can I ask a question?
Yeah,
Why not just leave that to you?
We have a hard time without explicit kind of direction from the legislature to say no to people. I mean, we have an uncapped licensing system, so
Mhm.
how do we kind of choose, you know, who we say yes to and who we say no to? It's better just to say, we're only gonna do 5. And
Or up to 5.
up to 5, everyone's gonna participate if they want to. But
But we don't have to specify the geography.
no,
no, I don't
Okay.
think so.
I would encourage us just to say up to 5,
And then you could have this,
and you can then manage it from there.
and you could have this language just sunset at the end of the year too.
Mhm.
Mhm. Well, I think that's what we're trying to get, a sense of how they work and
Yeah.
what the,
So that is that proposal, and again.
Can we just talk more about it?
yeah.
Why
absolutely.
5,
I just,
besides the directional?
that was it, yeah,
Okay,
yeah, and,
okay.
and if it's more than 5, then these things will likely happen on the weekend, meaning we'll probably have to send our compliance agents
Mhm.
on the weekend, it's just, if there were more than 5, it may start impacting our.
Okay,
Yeah, that's what I heard.
That's to me more compelling.
Yeah,
It's just a workload.
Yeah, that's what
Well,
I heard,
that's-
workload, was
yeah.
the reason to limit it.
As long as all 5 are in Chittenden County.
Maybe geographically.
Okay,
dispersed.
given your time frame, you have 2 more proposals.
Right, okay, so let me share a different document. Just gotta open it first.
So the next one we're doing is the regulation, how you're,
Yes, and this requires a little bit of context as well.
okay,
Did you talk about the fee amount?
now we're getting to that, which I don't want to spend too much time on in this committee because it's going to go to finance, but we should at least include it in the package so that finance will look at it.
It's an economic policy, how much of the fee?
Yeah, but it's a combination.
So, so this unfortunately requires just a little bit of context.
Okay, you-
Gosh, where is this? Apologies. Zoom is not.
Teams is better.
Can I just say something?
of course, yeah.
Mohsen Madawi was released.
Oh my gosh. It's amazing.
And barred the federal government from removing him from state or country.
Yeah. Let's see if
So-
that holds.
This is good,
Yeah.
and there wasn't an immediate effort to arrest him, which is really good. This is great, and what is he released under? Is there a provision? Becca's up there, so we'll have a.
Yeah, we'll
report.
get a full, yeah, I don't wanna misspeak about things.
Oh, yeah, Becca update. I haven't looked at my phone.
She probably doesn't have her phone.
Okay, let's
Okay.
pivot to the regulation.
Right, so, just the real brief history on this is, it's controversial whether you wanted to have a board at all for this industry. So the first thing you asked us to do was to present a fee schedule, kind of create a basic market structure, including a fee schedule that would fully support the regulatory burden of the board, fully fee supported. The reporting requirement went on to say if that's impossible, then recommend that you use a portion of the excise tax to cover whatever the difference is between our budget and the fee revenue. So in order to do this, we hired an economist, we kind of created a market structure, we presented a budget to the finance committee and the ways and means committee that would be fully fee supported, and then one that would be, the fees would be lower and the market would be more accessible. And you need to use a portion of the excise tax. So JFL looked at all these proposals, you guys looked at them. You decided in the end that even if you set the fees high enough to cover our regulatory burden, you may deter the accessibility, the kind of entrepreneurial interest in this industry such that no one gets in, because, at the time, Connecticut was coming online, New
Right.
York and Rhode Island and a few others, New Jersey. So you know, all the people that are looking at which market do I jump into would have just said, oh, Vermont's a small place and these fees are too high. So anyway, you decided to cover that delta with a portion of the excise tax, but because that was a controversial decision, you put a sunset on it. And so here we are. There's a way to check in, you know, now that you had actual data about how many people got in, what were the licenses, what was the fee revenue generated, how much excise tax was being generated, that you check back in 3 years. So we're at that point right now, starting in FY26. Excise tax will get direct deposited into the general fund, not through the Cannabis Regulation Fund, which supports our operations. And the delta will be covered through the general fund. So, you know, I think that, you know, you may say kind of, who cares? You know, general funds, excise tax, revenue, so this pocket or that pocket, you know, which I understand the kind of rationale there. I think the way that I see it is just slightly different, is that cannabis is a controversial issue. There's plenty of Vermont taxpayers that never wanted this board to begin with. They certainly don't want their kind of tax money supporting an industry that they don't participate in, that they're not seeing any benefit from. And so wouldn't it be better to kind of fund the board's budget from the businesses through fees and from the consumers that are benefiting from our kind of regulatory oversight directly? Now, one of the kind of more controversial pieces of this is that one of the foundational compromises that in the creation of the board was that 30% of the excise tax be deposited, you know, be used to support substance misuse prevention efforts.
Right.
And the way you structured the kind of the board's funding is you paid for our bills first, and then the 30% was calculated on the remainder, not the entirety of the excise tax.
Right.
So the prevention folks have been historically shortchanged by some amount of money every year because of that structure. So in the budget, you fix that. The budget creates a special fund where 30% of the excise
The
tax.
special fund is now called the cannabis.
It's called the Prevention Special Fund.
Oh, okay.
Right. So 30% goes directly into that fund as it's coming in. And so what this,
As it's coming in, does that mean monthly
I forget how,
or every quarter?
I think it comes in real time. I don't know the answer to that. But yeah.
So 30% as in real time goes straight to prevention.
Right.
Right.
And what this would do would say the other 70% goes to the Cannabis Regulation Fund, the kind of existing structure that we have. And at the end of the year, it pays for our bills, and the rest is transferred to the general fund, whatever's left over. So that's what this does. I'm sure there's, good arguments on both sides of this issue, but this is just, you have to deal with it. If you want to deal with this issue, you kind of have to do it a year in advance, because all of the consensus revenue forecasts are built upon what the law is or set to be for that next fiscal year. So the reason why this has an effective date of FY27 is because the revenue forecast for this year, for FY26, I should say, anticipates cannabis excise tax being direct deposited into the general fund.
Through the end of this fiscal year.
Through the
End of
this,
fiscal 26.
yes, right, exactly.
But then beginning in fiscal year 25, this is what the appropriations committee has, and the finance committee have agreed to already.
No one has agreed to this already.
I thought you said appropriations.
Oh, we've raised this with Ways and Means, House Appropriations.
Okay, so we'd be setting that here, and then it would go off.
Yes,
obviously.
right.
Okay, great.
And I think really the House understands this issue. They're prepared to deal with it. They just did not, with the education financing discussions, have the time to really focus on anything cannabis related early on.
So the proposal now is that 30%, instead of doing anything directly to the general fund, 30% in real time would go straight to prevention.
Right.
All the time, whenever those are good. And that the 70% would go to the running of the CCB.
Right.
And anything that is left over from that would go straight to the general.
Right. And I have a fee report that I've submitted. Essentially, we're raising about 2.4. So year to date, we've raised 2.4 million in fees. So probably 2.6 maybe by the end of the fiscal year. And our operating expenses are 6.5 million.
Just to clarify,
the fund timing that you're talking about, is this, if it passed, would be effective for FY '26 or '27?
27.
27.
Yes.
So that would then, the money would then begin changing direction in July of
Next
'26.
year.
That's right.
Okay.
Yep. And that just preserves the consensus revenue forecast. There's no gap in that, so, yeah. So that is that. The last issue I
So
have,
that's a big plus for prevention, is to have money. They don't have to wait. They get money directly in a constant stream.
and it's
30% off the
protected
top.
too. Yep, it is. It's protected and, whatever's unexpended at the end of the year rolls over. So yes, that fund, I think, regardless of how you decide this issue, that's a good structure.
Okay. And just to give context, last year's revenue was roughly 24 million.
It was, 17 million plus 17 million something, in excise tax, and then an additional 7 million in sales tax. So 24 million total. And then there's a local option tax that applies, but I don't have those numbers.
So I just would remind us that the sales tax goes directly to after school.
Yes, it's routed to the Agency of Education, and they have a special fund there that they, issue grants, and support for after school out of that money.
Okay, just so everybody remember, we had that conversation last year.
I'm a little over time for my next appointment, but it's right upstairs. The last thing was the kind of the fee, update to the fee schedule. And just the concept is indoor cultivators, on average can get between 4 and 5, maybe 6 harvests a year. Outdoor cultivators, unless they're using kind of really special genetics, can get one harvest. So shouldn't there be just a direct 1-to-4 ratio between the kind of price per square foot of an outdoor cultivator versus an indoor cultivator?
So this is considering parity. between the
Relative profitability, yeah. I mean, it's not perfect because, of course, indoor cultivators have much higher startup costs. Their electricity bills throughout the year and are extreme. But from a general perspective, that's the concept. Would be cut the outdoor cultivator fees in half, double the indoor cultivator fees, except for the tier 1s, because I think most people want to hold those people harmless. And that proposal, by my numbers, running them would be revenue neutral. But I can say JFO has not independently looked at them.
Okay, and I believe you've asked Ted to look at them?
I just asked that as well.
Okay, great,
Great.
terrific,
Okay.
thank you.
And my general counsel, Gabe Gill
Gabe
is
is-
here to answer any questions that come up throughout
So-
the day, throughout the rest of the testimony.
Okay, so who's running this screen?
That's me.
Was that you?
Yeah.
Okay, so you need that to go with you, yes?
Yes.
Gabe, and Michelle is not,
Kick me out.
okay, great. Thank you, Pepper, good luck upstairs. Gabe, you want to join us for a sec, or are people okay with sort of the sort of general amendment ideas? Okay, great.
Well, I didn't know if Pepper, one of the things we've failed on every year is putting money towards justice impacted people in a serious way. I have an amendment to that effect requested by the LAOB. I think that's the best place to put the resources, and your studies say that as well.
Yes, I mean, I think the evolution of this policy, cannabis policy, it started out just kind of an acknowledgement that people are consuming cannabis at record levels. Like, let's at least put some testing parameters around it, regulate it and tax it. And very quickly people understood that there's kind of a social justice aspect to cannabis policy, that prohibition was kind of disproportionately harmful to system.
Well, and who was first in line to get licenses and
Yeah.
benefit from its legalization were
Right.
not the same people as those who were.
Exactly. And so Massachusetts created the first social equity program to try to accommodate that. What I think most states now are realizing is, well, not everyone who's been harmed by cannabis wants to be involved in this industry. So shouldn't that money, a portion of that money, go towards community reinvestment in those communities? So that's what our report says, and the LAOB seems to be well set up to kind of receive and to do that work, but we don't get specific as to how much money should go to the LAOB.
Right, and they just have done, we don't know where the appropriations is gonna end up landing, but they did very well in appropriations, my
It's
understanding.
my understanding that their budget, which was, I think, temporary, is now permanent now.
It's not permanent, I think they got an additional 6 million, but.
No. Oh my gosh.
Yeah,
6
they
million?
did.
Oh,
They got-
wow,
well, they
I
got
would not be
considerable now.
speaking up. They got 1.6 million.
1.6,
That's their
and then,
budget.
and then their request.
No, that's their
is-
budget, but then I thought they got one.
No, their request is to take, I think, 6 million from the cannabis excise tax
Mhm.
to kind of support their functions.
So we will look at that,
Yeah, that's not even my proposal. It's a foot in the door on any overages, just so we can
Got it.
have the conversation.
Great, terrific. Gabe, do you think morning, I think we're ready to shift to other, witnesses, if you, but you're good at.
I'll be available if you have questions
Great.
about anything else, but.
Great, then why don't we invite Deputy Auditor Tim Ash up to weigh in on the section of the bill if he is interested.
She's here, but she's on Zoom. She's on this.
Great, thank you. Welcome,
Thank
it's
you.
good to have you.
It's great to be here. Deputy State Auditor Tim Ash for the record. I have a 30-second version, a 3-minute version, and then, because I like talking extemporaneously,
Oh, we could just
I have like
talk.
an hour-long
So
version, so
before
you choose.
Before you start, have you met David yet?
We've spoken virtually.
David Weeks and, oh my God, lucky you. And everybody else, I think
Lucky
you're.
you.
Yes.
Okay,
I believe 17 years ago, my first day in the Senate, I sat in this chair.
And then you,
Senator Miller was there.
Mhm.
Racine, Karas,
But I feel like the witness chair was here.
No, it was here, I remember, because Roman Kokadiniak, who was our committee assistant, he had this, he brought in a tabletop punching bag,
oh,
kind of suctioned to the table, and we would put it here sometimes, depending on the witness, just to sort of indicate how things were about to go.
oh my God, Roman,
I didn't do it.
I miss
Yes.
Roman. I miss
Yes.
Roman. So why don't you do the 3-minute version? and
I'll
go
do the
with
3-minute version. So there's section 14 in the bill as it passed the House. I think it probably is still in there somewhere, but it looks rather cryptic. It shows the deletion of a section from legislation that created this whole industry in the first place back in 2020. So I'm just going to read what the proposed language would actually delete. Back in 2020, there was a provision in the bill that created this regulated market that said, on or before November 15th, 2023, the auditor of accounts shall report to the General Assembly regarding the organizational structure and membership of the CCB and whether the structure continues to be the most efficient for carrying out the statutory duties of the board. We have asked, and that's what's reflected in the deletion, that report be eliminated.
It's on page 20 of 321.
We made that request several years ago because we thought that any appetite to do anything other than have the CCB continue to manage this system, even if it was going to be improved or have some of their practices change, there was no discussion of that. Whatever consideration had led to that report request in the first place seemed to have evaporated. And we thought going forward and using the time and money to do the report just because didn't make a lot of sense. Because the committees hadn't had a lot of time to hear our plight, appropriations, I believe, punted the issue like 2 years out. So now the language asked for the report this November. That was not their advocacy for the report, but just because they knew they weren't sure about it and didn't have the time to make a decision. So we've requested that we not be required to do this report. So we like the section as it appears in the bill that passed the House and ask that you keep it. And there's a good sort of timing issue, and I'm glad Gabe is here because I believe that the CCB has actually had a consultant on board who was looking at some ways to improve operational efficiencies and perhaps other things that Gabe could speak to. So in some ways, that seems a much more useful, appropriate use of resources, and it's already happening rather than have us go and do another report that's ill-defined. So that's my less than 3 minutes version.
Any
A
thoughts,
question.
former auditor?
What did the report supposedly consist of that you were assigned to do? What were they asking you of you?
There was, what I read was it.
That was
So
it.
there was, it didn't say how we would judge whether it was the most efficient.
Yeah, okay.
And at the time, I think there to be, just as I go in the Wayback Machine, because I was here, there were two potential alternatives to creating a new standalone board. One was the Agency of Agriculture, The other was liquor and lottery,
Right.
which was newly formed.
Yeah.
So but it didn't even specify that we'd be comparing how the CCB operates compared to those two entities. And then what does it mean to be, what is the organizational structure? How would we be determining if its current structure is the right one? So it was light on details, the kinds of
And
things.
has the auditor's office done anything relative to the Cannabis Control Board or cannabis regulation at all?
At this point, no.
Perfect, thanks. Any questions for Tim? Thank you.
Thank you.
We're under time. Great, thank you very much. Gabe, do you have any thoughts just to amplify the efficiency review is in good hands?
We think so.
Gabe, just introduce yourself.
So Gabe Gelman, General Counsel for the Cannabis Control Board. I can just second what Mr. Ash said. We have engaged a consultant who's expert in cannabis specifically and has a great deal of familiarity with interstate practices and best practices among cannabis boards. So, for that reason, we think they bring some specialized expertise to this task, and they are, specifically tasked with bringing us an objective look at how we're doing, what we can do better, et cetera, very much in the nature of an auditor's report. And I think we have some of the same concerns that the auditor does about both timing and benchmarks. The ask is awfully vague. And the board is still incredibly young in bureaucracy years. It's still building out its laboratory. So aspects of the operation are not really stable at this point. You might want to, if there is a future point when this is appropriate to be looked into, you might want to wait until there's, something of a market equilibrium in the cannabis market and some stability in the bureaucracy in terms of what the futures are.
But at the moment, if you have somebody embedded who's consulting with you on efficiency and how you.
Yes, and their findings, of course, will be a public record that will be available to scrutiny by legislators.
Right, terrific. Thank you. Any questions for Gabe on that? Great, we're gonna have you as a resource for today. Whoops, where did my list go? So, Amy, I think, Amy, you are, Amy Lems?
Yes,
Welcome.
thank you.
Good to have you. Come join us. Have you, and we have a couple new faces in the room, so but let's just quickly go around and introduce ourselves. Because I don't think you know us all.
Hi, I'm Tom Chittenden. I represent the Southeast Quadrant of Chittenden County.
Nice to meet you.
Keisha Ram Hinsdale, same district.
Allison Clarkson, your district, Windsor County District.
Randy Brock, Franklin County and Northern Grand Isle.
Nice to meet
Good
you.
morning, Amy. Dave Leeds, representing Rutland County.
Good morning, thank you.
Great. Good morning.
Good morning.
Good to have you.
Thank you for having me. I appreciate you taking the time. My name is Amy Lems. I reside in Norwich, Vermont and Windsor County. I'm a medical patient. I'm also a former Tier 2 cannabis manufacturer. I'm part of the Vermont Growers Association board member and legislative committee member, and I'm a member of the Vermont Cannabis Equity Coalition, or VCEC as I'll refer to it. I'm here today to support the legislative changes recommended by VCEC for Bill H321, priorities that when asked by Kesha, we discussed with other stakeholder groups, and we all, including John Rogers, agree to open. First recommendation is for the industry and community reinvestment, appropriating $1 million from the cannabis excise revenue annually for the Cannabis Business Development Fund, asking to include Tier 1 producers, as well as a robust technical and business support program. Also direct 25% of the cannabis excise tax revenue to the Land Access and Opportunity Board for community reinvestment programs. Second recommendation is to treat outdoor cannabis like farming. The recommendation calls for continuing to list aspects of agricultural status for outdoor cultivation into Vermont law and strike the municipal cultivation districts and setbacks for outdoor cultivation from Act 166. VCEC also recommends product registration and employment ID card reform, as well as striking the harvest and trim license proposal. Allow for biennial product registration and employee identification cards, and allow employees to work for multiple businesses. VCEC also recommends complete and cost-free cannabis expungement. the expungement of any and all cannabis-related charges, cost-free and without the need for an individual to petition the courts for the clearing of their records. BCEC also recommends public consumption wherever lit tobacco is allowed. Current consumption laws in Vermont are inherently inequitable, in effect, allowing only people who own their own private land or residences to consume cannabis legally. Otherwise, it prohibits consumption in public areas. BCEC recommends positioning the administration of eligible conditions and oversight of the medical cannabis program under the CCB by reestablishing the Symptom Relief Oversight Committee. This committee will facilitate the necessary input and expertise from patients, caregivers, and medical professionals being heard and included by regulators and make recommendations to the General Assembly on changes to eligible conditions. As a medical patient, I would like to see many improvements in the medical cannabis program. Most importantly, education. Add an annual, at minimum 8-hour continuing education course funded by the cannabis excise tax offered to all employees, not just those who are serving the MUE patients. VCEC further recommends striking the retail sitting rules language in Section 4, which is in the bill to create the effect of a 2-year moratorium for new retail licenses. Under Act 166, the CCB developed administrative rules with industry input as a mechanism to determine if towns like Burlington need another retailer. And finally, direct sales event permit. VCEC recommends allowing licensed cultivators, propagators, manufacturers, and retailers to perform regulated direct sales to consumers at temporary events with rules to be made public by the CCB, not beholden to retail opt-in. As a former Tier 2 manufacturer, I can speak explicitly to the need for direct consumer sales. It's the primary reason I declined renewing my manufacturing license last November. After 2 years in the industry with $100,000 in revenue each year, yet zero profit, I concluded my business was unable to be profitable at the current market structure. At present, the only option to get products to market is to sell them at wholesale price to a retailer or wholesaler. This gives retailers total control over what products come to market and what price the consumer pays. Our current market structure allows retailers to profiteer off small cultivators and manufacturers by overinflating the retail prices of products to maximize their own profit. As a manufacturer, I sell a product to a retailer for $10, $5 of which is my cost to produce. Then the retailer sets the retail price, which is normally $20, making their profit margin on that unit $10. Yet several retailers opted to overinflate the retail price of my products to $25, $30, or even $35, making their profit margin $15, $20, and $25 per unit instead of $10. Those higher prices slowed sales, which hurts the craft producer, but are highly profitable for the retailer who has no downside in this situation. Small operators cannot enforce intended retail pricing because when they try, retailers simply refuse to carry their products. Retailers are also allowed to directly compete with the brands they sell. They have products white labeled for them by a large Tier 3 manufacturer and then sell them as their store brand alongside other craft cannabis brands on their shelf. Some retailers purposefully sell their store brands at a lower cost, thereby undercutting the independent cannabis brands they sell at their stores. This is a win-win for retail stores, as it increases both their profit margin and their brand awareness in the market. Wholesalers are also allowed to purchase white label products, put their brand on it, and sell it side by side with the brands that they are representing. These are direct conflicts of interest that allow the retailer and wholesaler to compete directly with the brands that they sell and represent. At this point in the market, most retailers now order from a wholesaler because of the cost and convenience in doing so. Instead of ordering directly from each cultivator or manufacturer, retailers can place a single order, with a wholesaler for dozens of different brands and products. It means one order, one delivery, and one check, instead of ordering from dozens of brands, each needing separate delivery times, receiving inventory and payment. The time and labor savings is substantial for the retailer who buys through a wholesaler. There are also very few wholesalers in Vermont, and they limit the number of products that they carry from each cultivator or manufacturer. In my case, the wholesaler limited products to 10, yet my company made 48 products. In my case, the wholesaler, how do I get the rest of my products that have been researched, developed, tested, and registered to market? I don't, because there's no other way that currently exists. These small businesses cannot afford a one-size-fits-all retail license that currently exists in Vermont. They are simply asking for a reasonable way to get their products to market when no other avenue exists. Despite the oversaturation of retail stores in specific pockets of the state, the rest of the state remains a cannabis desert. Many small towns simply do not want to opt in for various reasons. Add to that, the mean population of our towns is about 2,000 people. The demographics don't support the expensive one-size-fits-all retail license. Yet there are plenty of consumers, both adult use and medical, in these small cannabis desert towns that would like access to legal, regulated Vermont cannabis products. Until a scale realistic retail license is made available, these communities go largely unserved. Direct-to-consumer sales can both bridge that gap and provide craft cannabis producers an alternate and viable way to get their products to market. Direct-to-consumer sales is the lifeline that small producers in the Vermont cannabis industry need to survive now. It benefits the craft producers by allowing them a way to get their products to market, while also benefiting the customers by offering them all of the possible cannabis products available at their intended retail prices. Thank you very much for your time.
Thank you. Amy, thank you for taking the time to travel all the way. Anybody have questions for Amy?
Wow, I was that thorough.
Well, it was
Compelling.
It was fulsome.
Thank you.
Fulsome. Thank you very much. And I think next on the list is Jill.
So I'm just joining the Zoom. Jill Sothoff-Garin, I am speaking today on behalf of the 3,200 physician and physician assistants of the Vermont Medical Society.
Great. And have you sent your Amy, have you sent your testimony electrically? You must have to Heidi.
No, I'm sorry.
Have you sent, would you be kind enough to make sure you send your testimony electronically to Heidi? Because then we'll post it. Thank you. Because we post everybody who testifies.
Can I ask one question?
Yeah, sure.
Is there a direct-to-consumer sales language proposal?
In New York State.
Okay,
But not here yet.
not,
But, sorry, Jeff can speak more immediately to that.
And I didn't interrupt, and thanks for asking, Senator. Over the past week, VGA, our coalition, and by the way, Jeff, hello, for the record.
Yeah, thank you. I was just about to say.
Sorry about that. We have worked pretty hard. We put several hours in working with other industry groups to arrive at that language.
okay,
And I want to make clear that largely every single group in this state that supports the sector, along with Lieutenant Governor, has agreed upon language that we would like to share with you all.
great,
So yes, we absolutely do.
yeah,
I want to be clear that the CCB concept does not include the option for producers.
Right, because I think there's some challenges with it that, from their point of view. So we will hear from both of you on
I
that.
appreciate that.
So when do you think, just to finish, Jill, sorry on this, when do you think, Jeffrey, you'll have an amendment that we can look at?
We are happy to send it to you whenever it is available on our documents. So, and we may have sent this to you in the past as well.
But send it to, okay, if you'd be kind enough to send it to Pepper and Gabe and to us, and we can all look at it, and we'll take it up probably next week.
Look forward to that conversation. Thank you.
Yeah, okay, great, thanks. Okay, Jill.
Great. So I definitely have a little bit of a different perspective, and I don't know if this will go to House Healthcare, but it's spring and I'm back in this committee. I'm usually here on cannabis around this time is what I feel like. I was looking back at past testimony on advertising protections. And so understanding that, we are talking about a lot of different ideas, and here we just had some comments on some of the ideas, and then we would probably have more just around the farmer's market piece. But generally, we do support the House passed version, and just when we're thinking about Act 164, this is about 4.5 years ago that we passed this, and it was really at that time that Vermont signed on to this promise, right? That we were going to come out of the black market with cannabis and we were going to create a safe, regulated market. And it was going to be for current cannabis users to safely access the products that they wanted. So it's not around cultivating new users or to grow an unwieldy market. And so we're just looking at this data and saying there's 110 shops. They're saying that they're oversaturated. They're not making a living with how many there are there. And so we do support a temporary moratorium because we think it could be a really good step. There are other states that have also had issues like this. So we're only 2.5 years in. And so it makes sense. What do communities want? What is the appropriate density on the statewide and the community level that is both looking at protecting public health and sustaining a safe, regulated market? And I hope that that's refreshing because it's not just prohibition. It's talking about how we can all work together on this. And so we just have 3 areas, and I do think that the farmer's market piece is something that I've seen is coming up in Massachusetts too, the special events piece. It would just really be something that I think should go to rulemaking, which would slow it down. But I think that you do have to consider how you're going to have the public health protections in there. What we're talking about is, in this slide, is just how do you keep those public health protections in place if it's direct sales
At the farmer's market.
at the farmer's market, and then also with the proposal that the growers and others are talking about with Lieutenant Governor as well, of on-farm, off-farm, just the.
Let's focus first then on the farmer's market, because that's a very different direct sale. It's a much more regulated, I mean, it falls under the umbrella of regulated direct sale.
Yeah.
And it would give our growers an opportunity to do direct sale and develop relationships with consumers. So how do you feel about the farmer's market direct sale? Because I think that's very different than the direct sales farm to consumer.
So we didn't get a chance to review that.
Okay, so if you would.
Language, but to me, having retailers that have to abide by point of sale laws and the public health protections does make some sense. It's just, how is it going to be advertised? Where is it going to be held? What does that do for our saturated market as well? And that's one of the things I have on my slide, is that we have 414 growers right now and 110 retailers. So you really do have to consider, if you're going to do any sort of direct sale, how does that impact our retailers? How does that impact the whole entire regulated market? Because we feel like it could implode it and then people go back to the black market, which we don't want.
Yeah.
So I just want to, I guess, ask 2 things, because they're 2 very separate issues, the health and exposure impact versus the retail saturation. I mean, that's an economic question. Farmers markets exist everywhere. And in some ways, their cheese and milk and vegetables compete with supermarkets. So I don't know that if you're talking, I don't know why that would be part of the medical society's concern.
The only concern that I'm voicing is the idea that we want this market to survive because this is the safe and regulated market that we've all invested in.
Uh-huh.
And we don't want to go back to the black market.
Right. So I think what people are saying is this helps the market survive in a different way. So that's a separate conversation, but we had this same conversation. You were here for it, Senator Clarkson was here, Senator Brock, about alcohol. About direct sales at farmers market of alcohol.
Oh, I wasn't here for that.
You weren't? Okay. Well, I don't know what role you were in, but I thought you were, because it was a long, long journey.
Yeah.
And I would just hope that we've learned something from that and that you all have learned something from that. I don't think that had huge public health impacts, but if you feel differently, I'd like to see the evidence, because that we used the same arguments then, or we heard the same arguments then. And I have not seen any evidence of a major public health impact from our bespoke small liquor and alcohol producers tasting at farmers markets.
Sure.
Yeah, and I think these are, again, within even that, they're two different, because you have this slide up on direct sales, and I think direct sales are a separate conversation from the farmer's market. I think giving the farmer's market pilot an opportunity to have a sort of controlled version of direct sales in these farmers markets is a good idea and it helps move us forward. But I think
wine and beer also has DTC.
Yeah, right.
And I'd like to move forward with spirits having DTC.
I would encourage it, if you want to think about the farmer's market piece, great. But that's a farmer's market and the showcase direct sales. And then I think what you're wanting to weigh in right now is the direct sales on the grower's farm to the consumer. Is that right?
Right. And it's,
okay, so let's shift to that.
Right. And it has to do with density as well, right? If there's 414 growers, we're talking about a lot more. And what that does for public health is just make more access for youth. And then also research shows that when you're doing those direct sales, that those public health protections are not going to be first and foremost. And so that's why
does the Vermont Medical Society ever undertake to do its own research? Because that would help us, I think, more. I see youth exposure to advertising. I think there's a lot of sports betting youth exposure to advertising, even though that's in our law. But I don't know if that means that the impact is that they are consuming more. So we have DTC for alcohol.
Well, public health, Department of Health has that data.
Okay.
On the consumption, and I don't know.
The youth risk access is, I think, something that we will turn to.
And I have a slide that has this on there as well. Sorry, not wanting to take too long.
No, that's okay.
That changed with DTC. Did it change with direct sales to consumers? Not advertising, but direct sales to consumers.
Cannabis use among our youth, did it change? So I would say that it wouldn't be statistically because.
But with alcohol.
Oh, with alcohol.
Has anybody researched that? Because we had that fight for so long.
Yeah.
And if people aren't evaluating that it would be hard for me to listen to claims that are the exact same that we heard about alcohol without new evidence to show that there was any harm.
Yeah. Well, and they're slightly different.
They are different, yeah.
So.
The other thing that we have come in here a number of times on is advertising regulation, and just again going back to how we really wanted to create a market that had public health and public safety as a priority and did not want to create new users. And I found this article from 2020 where we have quotes on not wanting to create that new users, just because we know that youth are extremely susceptible and to marketing. And so what we need to do is just make sure that we're protecting our youth within this. And so we don't support expanding advertising for cannabis right now. And this is similar because so much is online, right? So we're protecting our kids in the same way that we want to protect them with Kids Code or anything else, because that digital marketing is everywhere and the youth use does go up with that. So here's one of the things. This is free advertising, right? So what we hear a lot is that they are not that retailers are not allowed to advertise, but Google itself provides so much information that it makes it very hard for us to feel like we are not getting enough of this advertising. And so we would just say that the risk on the other side for youth, because we do have a lot of data that shows when youth have this constant barrage of cannabis, they feel like these are trusted brands and they use more.
I'm sorry, we're looking at a Google search of legitimate businesses, just like we could look at a Google search of bars.
Yeah, and the
So,
way,
I
why
don't know
put
what
that-
we're doing
Why I
here.
put that there
Yeah.
is because these are, what we're talking about with our advertising restrictions is that less than 15% of youth under the age of 21 are going to see these advertisements, right? That's what we're talking about. And what Dave Silverman and others have said is that the CCB is overly restrictive and it's muzzling their industry. And I would just say that, here you can see every product, there's reviews for every product, and that impacts youths, because that is something that they can access, and then those are some of the channels in the way that they can access those products as well.
I guess having worked on creating economic markets for things that were once illicit for a long time, and including when we had this conversation about alcohol and malt flavored beverages, and I was on House General 15 years ago. At some point, you do have to recognize that young people will be exposed to dangerous or illicit things, and that we also have to manage that exposure in a way that gives them the tools to deal with that. I don't see how we could stop Google advertising.
No, I'm
from
not
existing.
I'm not sure we
suggesting
can, and
that.
I would just point out, there is no advertising section in this bill. So I would love to have us move, if we can, finish Jill's, you're supporting the current advertising rules and regs that CCB has. That's what I
Yes.
think we're meant
Yeah,
to
and
hear.
Without knowing what you were going to pull on, we were just trying to
Right.
give our.
So there is no change in the advertising proposal yet at this moment, and certainly not in the bill that we got from the House. So if you would keep going, 'cause I know you have a
Okay.
third concern,
Yes.
because we have 3 other people. who
This
are-
was the other piece that I just wanted to make sure that you are not going to be increasing the potency of the edibles. And this is because of all of the recent pediatric cannabis accidental ingestions. And so this is the most recent, but I will just jump to the data here. And you can see it's just exponential how much it's gone up since legalization. And this is national data that I have here, but this is actually from a pediatric intensivist from Vermont, where she's talking about what happens in her practice and how it's really scary and how she's had to intubate toddlers. And so that is directly correlated with the dose ingested, and it's youth, it's dogs. And so I just would say, please don't increase that right now. We just don't need more of this happening to our youth.
I'm very sympathetic. I have 2 very small children who get into everything. They could just eat 2, right? I mean, if they find a bag of something, that's a problem.
We're saying if they get into, like, right now, the point of sale flyer even for the CCB says if you're going to have an edible, start slow, 1 to 2.5 milligrams, right? And so we're saying that is the 10 milligrams is a lot, and that the dose matters. So please don't increase it.
Right.
Was some of your data about other states that have a 10 milligram limit? Can you go back?
No, I don't have
Oh,
anything
okay.
about other states.
Okay,
having that. I just had what the data shows with the
so-
pediatric.
just an increase in ingestion
Yes.
when we legalized.
Yeah.
Right.
Okay, from what to what? It was hard to see the number.
Maybe you'll send this to us,
Yes.
and if you send it to Heidi, that's
It's a
great. then we can look at it.
1,300% increase.
What is what are the numbers
The country.
in the country? What are the numbers?
Do you want me to read them?
And then we're going to move to Jesse. And
You're gonna submit that too, I'd love to look
Yeah.
at it as well.
yeah, you're gonna send it to us.
Yeah. Number 2017 went to from 207 to 3,054.
Cases of, yeah.
Yeah.
Okay. Well, send it to us,
From
Jill.
2017.
It would be good to see.
Yeah.
Concerning, yeah. Thank you.
Yeah.
Jocelyn Dolan, welcome.
Thank you so much for having me.
Thank you for joining us. If you just introduce yourself and give us your testimony.
Got it. Thank you. Thanks again for having me here today. My name is Jessie Lynn Dolan. I'm a registered nurse. I am in the middle of a 13-hour shift today. I have a note on my door, hopefully won't get interrupted by any patients. I'm also the immediate past president of the American Nurses Association here in Vermont. I'm a medical patient myself, having had 40 surgeries. I'm a mother and I'm a cannabis caregiver for my son who chooses cannabis over opioids. I'm a former Tier 2 outdoor cultivator. I'm a former director of the American Cannabis Nurses Association National, co-founder of the Green Mountain Patients Alliance, which is a member of the Vermont Cannabis Equity Coalition. I've been an advocate for many years with a focus on patients and consumer safety. When we advocate for the medical program and cannabis patients' interests, we're advocating for all individuals who consume cannabis medicinally for symptom relief. Many people choose cannabis over pharmaceuticals, alcohol, or illegal substances, regardless of whether they have a medical cannabis card or not. As of July, a medical use endorsement retailer license is available, as you know, to serve medical patients in the adult use recreational community. This will mandate enhanced training and educational requirements for employees who interact with those patients. Unfortunately, we don't necessarily support the Vermont Medical Society suggestion of using UVM Science and Medicine course to satisfy those educational requirements due to the prerequisites, time commitment, and prohibitive cost it has. We recommend an annual, not every 2 years, an annual minimum of 8 hours course, as well as monthly continuing education paid for by the cannabis excise tax, free to all employees, not just those serving the MUE patients. There are dozens of retailers, hundreds of employees who will attest to the need and desire for educational courses with greater depth. Patients, consumers, especially older adults who are the #1 consumer coming to cannabis, and staff need credible education and resources to help them understand and find answers. Historically, education has not been prioritized in the medical program and has not at all been prioritized in the adult use program since inception. From the start of the adult use in 2022, Vermont had a free to patients and consumer cannabis hotline staffed with registered nurses to help educate and support patients and consumers. In 2024, 7 Days article, Pepper himself was quoted saying the fastest growing demographic of people using cannabis for the first time are 50 years old or older, and there's no good source of reliable information. So the Cannabis Nurse Hotline is stepping in to fill that gap. 75% of callers were over the age of 65 on multiple pharmaceuticals, did not want to get high, but wanted symptom relief and had no medical professional to talk to. The hotline shut down in April of 2024. Currently, the CCB guidance and public statements make it so medical professionals are unable to work with or therefore provide education to adult use retailers without the cannabis business risking disciplinary fines. Retailers who will be serving patients with the medical endorsement and need enhanced training, but can't have it from a medical professional. We request this guidance to be repealed altogether or exclude MUEs and state revenue taxes to consider funding a nurse hotline for the MUEs. The CCB had 4 meetings with stakeholders and produced a report of medical recommendations. This report has not been yet addressed. We asked to debrief this report and include the recommendations before the bill is passed. Ignoring the report is a disservice to patients and would equate to a waste of time for the CCB and all stakeholders. In these legislative recommendations for the medical program, they propose a 15-question online standardized quiz and app called Canify as the solution for enhanced education. We do not support this recommendation with valid concern for an unregulated app. With spotty service in Vermont, #1 customer being older, less likely to use apps, an app does not seem enough. An app paired with a nurse hotline, individualized, unmatched levels of supports, what patients and Vermonters deserve. We agree with the Vermont Medical Society's concern of Canify's product bias as well as commercial influence based on the extremely specific product recommendations they give and lack of transparency. One I believe we all, the CCB, Vermont Medical Society, or VCEC, agree upon is the CCB's recommendation to move the administration of eligible conditions and oversight under the CCB by reestablishing an oversight advisory panel, as we had prior to the adult use program, to help administer and manage as well all other aspects. GMPA did provide specific structure recommendations in the medical report. We have a medical cannabis program that has no medical professionals' feedback, no way of allowing patients and caregivers to have voices. Now medical professionals are banned from MUEs as well. A bit concerning to this medical professional here and many other medical professionals who are aware, as not many are. This is the run request I hope to see easily and quickly agreed upon before this bill moves forward, as most all stakeholders have agreed on its necessity. GMPA has met with VMS this session and hopes to again continue collaborating. We would ask to meet with the Department of Health, especially regarding our deep concerns and hopes for education. Regarding other recommendations and advocacy points, we do ask to increase medical plant count numbers from 6 to 12 in flower, as well as allow caregivers to care for 3 patients and patients to have 3 caregivers. We ask to raise adult use plant to medical count. Many adults consume medicinally, but do not want or cannot get a medical card. GMPA continues to advocate anyone giving a prescription of opioids automatically qualifies for a medical card, as other states do. We seek employment and roadside testing protections, workperson compensation for medical cannabis, as well as financial assistance for medical cannabis. We discuss the cannabis excise tax and taxes and funding allocations often. So with that, we ask to reestablish the medical cannabis fund to help vulnerable patients and bring medical cannabis transactions to a standard wholesale price. So we ask a lot. The adult use market is operational, but much work remains to make it equitable and viable, especially the medical program. GMPA supports the policy positions of VCEC, their ag-related policy to allow on and off-farm direct sales of cultivation tier 1 and 2, and believe direct sales is the best way for patients to get the most affordable cannabis instead of more affordable alcohol and opioids. We do not support retailers being the only one profiting from this as compared to farmers directly selling and profiting themselves. Retailers profit regularly and more than manufacturers and cultivators by far. We ask to allow public consumption where tobacco is lit tobacco is allowed, Vulnerable Vermonters and patients need to legally consume their legally allowed cannabis medicine without risk. Most of the cannabis medical patients and cannabis adult use workforce rent and have no legal and safe right to consume. I'd also love to personally conduct research myself. I'm a former UVM research nurse who's published cannabis research overseas. I work specifically with the elderly, the #1 population using cannabis. On-site consumption and allowing research would be huge, as Ms. Ram already spoke and asked about. We asked legislators.
Jesslyn, we need to, would you be kind enough to submit your testimony to Heidi Parker, to our assistant? And I just need to ask you to conclude because we have one more witness before we're done.
Absolutely.
So, if you are near the end, that would be great.
Oh, yes, absolutely. I have 1 or 2 more things to quickly mention. We do support and ask you to direct $1 million to the cannabis excise tax to the LAOB board as recommended. We also ask to complete expungement of all cannabis charges and not recriminalize. Lastly, regarding advertising, I would just like to mention that alcohol and tobacco should be as prohibited as cannabis, or cannabis should be less prohibited. Alcohol and tobacco kill, cannabis doesn't. Let's focus on harm reduction, which is education. And as far as potency of edibles, it's no different than wine versus whiskey. So let's look at that perspective as well. Again, I thank you for your time. I will email you this information and I'm always open to questions. So thank you.
Great, thank you, Jesselyn. And just given our time, unless there's a burning question or something, I'm gonna thank you very much for joining us. And no one interrupted you, which was great. I mean, so Kelly.
Yes.
Welcome you. And Jesselyn, please send your testimony to Heidi so we have it up on our website under this subject.
Thank you.
Right, so we can all access it.
So
Kelly,
good morning, almost afternoon. Kelly Doherty, Deputy Commissioner at the Department of Health.
Great, good to
And-
have you. I think this is your first time.
It is, yeah. So it's nice to be here. Thank you. So I am here to strongly advocate for preserving the 30% of the excise tax going to substance misuse prevention and not allow it to be used for other purposes.
Which is what the CCB just proposed.
Exactly. I want to remind the committee that when Governor Scott signed the bill to allow for a commercial market, this was his compromise, that he would allow a market for cannabis provided that 30% of the excise tax went to substance use prevention. We are in a state right now where the prevention funds that we were getting from the state are no longer, because they're planning to shift to the excise tax. So we will actually lose funding if some of those funds go elsewhere this coming fiscal year. So we have a prevention network across the state that is, we have prevention lead organizations that were established a couple of years ago that fund over 60 organizations across the state focused on substance use prevention. Obviously including cannabis, because they really take an all substances approach. And we know from data that when you invest in prevention, the indicators for substance use, particularly among youth, go down. And so we are adamant that the 30% is needed in this state, even to just preserve the prevention activities that we're doing right now. So I'm happy to send you something in writing. I didn't write my testimony, but and I can also share some of that data with you.
Right, so we've had 3 years of prevention work going on now, and I think this is a very results-based committee.
Mm-hmm.
And we would, I think, really appreciate hearing what the results are of your work to date. What you do the youth risk assessment every year.
We do.
And I think we would really appreciate to see seeing what the results are. If you are able to do that within the time frame that you've had 3 years. So.
So we are actually we contracted with an evaluator who is doing work right now in the field, and we expect to have those reports in October, but we certainly have other data that we can share with you.
You have the data through 24, yes?
We don't have youth risk behavior survey through 24 because it's only done every other year. So we have 2023. Yeah, so I can send you a summary of the substance use sort of indicators from 2023. We know that just under a quarter of youth report using cannabis in the last 30 days. And
is that up or down?
It's actually about the same. And then 35% of youth reported that cannabis is very easy to get. And 58% say that it's either sort of or very easy to get.
Did that go up from pre?
I think it's about the same, but
it's the same.
Yeah. But some of these things take time, right? And prevention efforts in particular kind of have to be in place for a while before you really see, a lot of results, because it's a long-term effort. But we will get those reports from our evaluator in the fall.
Right. Keisha, you have
Well, yeah, are you the last witness? I don't.
I think
Kelly,
so,
and then
unless-
Gabe is gonna
unless
do.
Gabe-
Oh, okay. I mean, I thought you could tell us even what kinds of things you're funding
Yeah.
that you
Yes,
think are making a
exactly.
difference.
Yeah, so we're funding those Vermont, the prevention lead organizations, so there are 4 of them in the state.
Mhm.
And what we do is we fund them and then they fund coalitions and programs in their regions.
Mhm.
And this is a different approach that we instituted, I think it was 2 years ago. And what it does is it allows much more regional coordination of prevention efforts. So we would continue to fund the prevention lead organizations. We would continue to fund our school-based work,
Mhm.
prevention work. And
Which
that
is different from after school.
exactly. And that would eat up almost all of what we anticipate to get in the
Mhm.
cannabis excise fund.
Do
know,
you get
this
the
year.
same amount from tobacco?
You mean from what source?
From the tobacco
From-
settlement.
Oh,
Well, tobacco's not just tobacco
Yeah.
settlement. We tax tobacco
Yeah,
very heavily.
yeah.
And
I'll
more
have to look and see. I think we get slightly less. And actually, the other thing to put on your radar is with the federal, what's going on at the federal level, we anticipate that we're going to lose some prevention funding, which could include
Mhm.
tobacco and could include substance use prevention.
Yeah, I mean, a lot of those organizations do incredible work
Mhm.
and a lot of it's focused on tobacco.
They do
Um,
both, yeah.
Yeah, I mean, whenever they ask me to get involved, we're talking a lot about tobacco, so
Yeah.
I would just hope that you would come back with a proposal to look at that maybe first and foremost, if
Mhm.
you're not even getting an equal rate
Yeah.
from tobacco.
And when you say it goes to the schools, did it go
This
into
is-
school counselors?
It's-
Who's doing the prevention?
Yeah,
work at
there are
school?
substance use, prevention, what are they called? Substance use prevention, something in the schools. It could fund those. We just require that schools use programs or curricula that are evidence-based. So schools can kind of tailor their prevention efforts to what's gonna work for them in their schools. We would really love to expand our presence in schools because we are not in the majority of school districts in the state. So we don't have enough funding to direct to all school districts. So
Keisha, and then we're just gonna.
Yeah,
go
I mean,
back.
I think this is a conversation we might want to continue in the education committee,
I
because
agree.
we have a huge mental health counseling need.
mhm.
If all of this money, I would put toward that, because I think that helps kids get other tools than just say no. And like, that's where I'm looking to put more resources. So I don't know if you're coordinated with the Department of Mental Health
Yes.
in that
Sure.
regard, and if we could continue the conversation about, counseling and mental health interventions being a great way to prevent
Mhm.
substance use.
Yep, I wouldn't want to lose our funding to the local coalitions and groups that the prevention lead organizations are
No,
funding.
but if you're adding anything,
Yeah.
I don't know that just being in schools is as
Right.
helpful as counseling
Yeah.
and mental health.
Which are awesome.
And are you doing addiction to social media and cell phone?
Not really. no.
Okay.
Because I think they all go hand in
They
glove.
do go
quite
hand in
honestly.
hand, yeah.
So thank you very much.
Yes,
And if
you're
you
welcome.
get us the rest of that
Sure.
information and maybe come back with
Yep.
some of the rest, I think we'd like that. Gabe, do you have anything for cleanup? Or are you gonna say more to follow as you respond to all this?
I could file something with you if you'd like, just, I can put a few things to rest. There's nothing, a lot of testimony concern things that are not in the bill.
Correct.
There's no change to almost any of that. We are totally unaware of any viable consensus language on direct sales. No state in the United States does that, and there's a reason. And it's not about farms, it's really about administrative feasibility. We have 9 people in the field. If we had cannabis sold at the end of 400 driveways like corn, we would effectively just have.
Are any other states looking at it?
No. New York did what they did, as Pepper explained, because they got in a very unusual circumstance. But obviously, in any market, retail is a thing. And of course, the suppliers feel like the retailers are ripping them off. But the retailers, I think, unseen, play a very important role as the experts in, IT, inventory tracking, tax collection. And we have the entire system was built around that architecture with that entity as the person that makes sure all those features are in place and is accountable for it. And we would break the whole system to do what has been suggested. What we can do and are doing is, and we've been told to, is look out for small cultivators and use our rulemaking authority to level the playing field and make sure that things are fair and that small cultivators are not overborne. We've been tremendously successful at nurturing small cultivators in the state. We have 400. My colleagues in Connecticut have 3. So, you guys set out to do this as a project. It really succeeded, but direct sales is not administratively viable.
So thank you. We're at time. I see the growers. I think we're happy to look at whatever amendment you send our way.
Thank you.
And this is a robust conversation, I know. So thank you all. We are going to conclude for the day. Thank you.